All right, so welcome. My name is Jerry Williams, and I am the founder and president of Myositis Support and Understanding. And I just want to welcome you tonight to this session, Understanding Dysphagia with Suzanne Belmonte. Suzanne is one of our volunteers, and she is just an amazing person that we have come to know over the years. And, we just value her. And we have a very special treat tonight because not only is Suzanne a myositis patient, she's also a speech-language pathologist, which is a specialty that we often turn to for help with dysphagia. Now, keep in mind that this is not medical advice, and I can't stress this point enough, and Suzanne will also. Please talk to your doctor about any signs of trouble swallowing, as it can be so dangerous with choking, aspiration, which can lead to aspiration pneumonia, and a host of complications that you just don't need. So please reach out to your doctor. We love questions, so please locate the Q&A icon in your Zoom toolbar. It's kind of next to the raise hand icon, and enter your questions there. If you would like to ask your question live, we would be happy to unmute you at the right time and let you do that. So with that, hi, Suzanne. We appreciate your willingness to be here tonight to share not only your expertise, but also your experiences from such a unique perspective. Would you like to introduce yourself?
Thank you, first of all, Jerry and MSU, for allowing me to come on and speak about this subject. My name is Suzanne Belmonte. I am, if you can't tell, I'm from New York. I'm from Long Island. I do have a habit of speaking quickly, so I'll try to work on that so I don't speak too quickly for you. And I'm going to go through my history of myositis and whatnot, but I am a speech-language pathologist. I am currently out on disability thanks to myositis and have been for the last 3.5, 4 years. Before that, I did work in a middle school, and that's primarily who I worked with. That was where really the bulk of my experiences is working with school-age children. Although I did have about a 1-year stint of working as a per diem in a nursing home. So I did work, ironically enough, on dysphagia and as well as cognitive difficulties with stroke patients and the elderly. So, when myositis month came up and I was speaking with Jerry, I said this would be something interesting to kind of present to everybody. It's, and I named it a condition that's hard to swallow, the perspective from an SLP who is also a patient, because never in my wildest dreams did I ever think that I personally would have to deal with dysphagia. And again, just to give a disclaimer, just as Jerry did, any of the information that's being provided here this evening is just solely as general information and my own perspective and should not be taken in any way as medical or treatment advice. I would urge you to please contact your medical team for an evaluation and treatment of your particular condition. Should you suspect dysphagia, have any trouble with swallowing or anything of the like, they can go ahead and point you in the correct direction. So please keep that in mind. Okay, so, things that didn't feel right. A little background about me and how I ended up with dysphagia is I was in April of 2017, I was diagnosed with non-Hodgkin's lymphoma. Pretty scary thing at the time. And it was found by happenstance. I just happened to be at the ENT for a different matter, and he's feeling around, and sure enough, there was an enlarged nodule. And one thing led to another, and it was biopsied, and I had received that news. Now, to give you a little perspective of where I was during this whole time, by the time I was diagnosed with myositis, we had gone through a lot in my household because first I was diagnosed with the non-Hodgkin's lymphoma. And then about a week later, my husband was diagnosed with prostate cancer. So you can imagine how terrified we were. I have 2 teenage sons. At that time, they were 17 and 14 about. And, we were terrified. We didn't know what to expect. All I could think about was, would I be there to be a mother to my boys and whatnot? So we go through that process. My husband has surgery. I speak to an oncologist and he says, no, don't worry about it. This is the easy cancer. So I said, oh, great. Easy and cancer. I'll take it. They put me on watch and wait, which watch and wait is when there is absolutely no intervention at that point, because the cancer was not very active. I had a small tumor burden. And, while I was stage 4, with lymphoma, that's a different staging process than it is for a site cancer like breast or colon or prostate. So I was on watch and wait, and we just kind of went along. And I went and I had my summer and I wrapped my head around that. And I said, okay, I'm just going to go. My husband was doing well from his surgery. I was returning to school, the school year, and went back. And I remember, the beginning of a school year for a school, a speech language pathologist is a rough time. We're working on scheduling and, trying to figure out what the issues are or the goals for our particular students are and what types of students we were going to be working with. And I work primarily with students with autism and with Down syndrome. So they're in middle school. So that presents a whole new, league of challenges that come with it. And going through the beginning of the year, and I'm doing my thing and we're running around, and it's back to school night. And I had noticed the week before, so I kept getting like a fever at night. And I'm like, oh man, I must be getting something. It's, the back to school, I'm back in the, petri dish of a school. I must be getting some sort of a cold or something's coming on. So every night I would just get this low grade fever, and I would, go home, sleep it off. And the next morning I'd be okay. I felt achy, but, I just powered through. It was what it was. I was getting a cold. So we had back to school night. And I remember sitting there with my colleague, and I was walking down the hall to my office, and my legs were just killing me. I was having trouble walking, and I'm like, what is this? And I said, I must be getting the flu. And sure enough, that was the beginning of a roller coaster that I just never expected to go on. And that was in September. So we're talking about approximately 4 months after my diagnosis of non-Hodgkin's. Now, keep in mind, by this time, I had no idea what myositis was. Didn't even consider it. I've heard of myopathy, but I didn't hear of myositis. I didn't know what that was. Well, I ended up swelling. My whole body took on a huge amount of fluid. I eventually could not walk. Or if I walked, it was very difficult. I couldn't put my shoes on. My husband had to take me to DSW, and I had to get like clogs because I couldn't even fit my feet into regular shoes. So by this time, I'm calling out of work several times. I go in to see my oncologist thinking, oh, wow, maybe it's the lymphoma that's acting up. Sure enough, he looks, and my numbers are starting to go up, and my spleen is enlarged. And he said, yeah, it's time. So I said, okay, now we'll do what we have to do. So he says, we're going to put you on rituximab. I said, okay, great. I'd rather that than a standard chemo. So I start through my first rituximab. I do okay. I have a little, a few side effects or whatever, but it's fine. I make it through it. Well, suddenly I start to get worse. I start getting tingling and pain in my feet and my legs. And no matter what I do, the pain's not going away. I'm sobbing at this point. My husband, poor husband, doesn't know what to do with me. We end up going to the hospital. They, of course, run blood work and everything, and they can see I'm having trouble walking. And what do they come up with? What everybody probably gets told initially when their CK or CPK has risen. Oh, you have rhabdo. I said, rhabdo? How can I possibly have that? I don't exercise. I mean, yeah, I kind of went to the gym once or twice, but not enough for me to get something like that. Well, that's what you have. Okay. So I get a huge steroid infusion. I get filled with fluids, and I feel a little better, and I get sent home. They give me a couple of little small couple doses of pain meds, and on my way I go. Couple of days later, it's back. I feel terrible again. This time I said, I'm not leaving. You need to admit me. So they admit me, and I said, yeah, I want you to send somebody from my oncologist office here as well, because this cannot be right. And thank God I have my primary care doctor she's amazing. And she is such an advocate for her patients. My husband had contacted her that I was in the hospital, and she said, I want to, based upon what you're telling me, I think we need to get a rheumatologist involved. So she sends a rheumatologist who doesn't belong to our hospital, but he comes in and he doesn't really know what to expect. And he's very quiet, very shy. And my husband's like, oh, we're so glad to see you. Maybe you can give us a help. And I had a tiny little bit of a rash, I guess, that shawl rash, nothing significant. I mean, I'm fair. I blush very easily. I get blotchy very easily. So nobody thought anything of it. That's just who I am. And he said, no, you kind of have that shawl rash. So he goes, I tend to think it's dermatomyositis. And we went, dermato what? So of course, what do? I have my phone, I start looking things up. Now, during this time, I had noticed that my swallow was getting a little funny. Things felt like they were getting stuck in my throat. And I figured, oh, it's just this inflammation. Maybe I'm not taking enough fluids in. I'm getting too dry. I don't know what it is. So I said, I'm not even thinking that I'm having dysphagia at this point. I don't even think about it. I just thought something else was going on. And meanwhile, I'm educated enough that I should have thought about that, but I didn't. Now we spend my anniversary in the hospital, and my husband brings me a cheeseburger because that's what was available at the time. And so excited, going to get some real delicious food, and I can't eat. And, they're like, no, don't worry about it. It'll be fine. It'll be fine. So again, another huge burst of steroids, some more pain medications. Things seem to be a little bit better, and I go home. And I continue on to have my treatments every other week of rituximab. Well, a couple of weeks later, and not even, maybe maybe 2 weeks, a week, 2 weeks. Now I'm home. I cannot work anymore. I'm still swollen. I'm having a lot of difficulty getting up and getting down. And I figure they're saying, well, you have to wait. You have to wait to have your body react to the Rituxan and, the cancer and whatnot. And no more mention is meant about the dermatomyositis. We're just kind of going our way. And, he figured the steroids would be good. And that was it. That was all that needed to be done. Well, P.S. I end up having to go in. First I'm sitting in the kitchen, and my mother-in-law is now babysitting me because my husband has to go to work and he's afraid of leaving me alone because I can't even get out of the couch. So she makes me some oatmeal, and she's like, you have to eat. Yeah, I'm like, all right, I'll have a little oatmeal. So she makes me oatmeal, and it's not going down. And suddenly a light bulb goes off in my head. Why it took so long, I don't know. And I said, I have dysphagia. And she said, no, she's a nurse from many years ago. No, I don't think so. I said, yeah. I said, I can't swallow. And then I started to notice that liquids were going through my nose. I would cough and it would go through my nose. And I said, yeah, I'm having a problem. Something is wrong here. I said, I need a feeding tube. She said, stop. You're being, over analytical of the situation. And I said, no, I really think that that's what it is. So P.S. I ended up getting really bad. She called my husband. She's like, this is not good. You need to bring her in. So right away, I was rushed into Sloan Kettering in New York City, where my oncologist was. And I again told them, I said, I'm not leaving. You need to fix me because something's wrong here. And I'm afraid that I'm going to die if we continue. So sure enough, that's what was. They let me in. They pulled in a full team of professionals, and I kind of went out of the way here with my slide, but they pulled in multiple medical teams. I kind of was the case du jour. Nobody knew what to do with me. In Sloan Kettering, they don't get a lot of myositis patients. They had to call in somebody, a specialist from the hospital for special surgery, which was next door. And they had a full team that came there. And every day I would have a parade of doctors that would come in and check on me and ask me questions and poke and prod me and see. And by this time, I'm not moving anymore. I can't lift up my head. I no longer have the ability to move my arms. I can't move my legs. I can't toilet myself. I'm not eating at this point. So they have me on a drip and it's not getting better. So no matter what they're throwing at the wall, it's not getting better. Finally, they go to put an NG tube in. Now, an NG tube is a nasogastric tube. It's where they can access the stomach going through the nose down through the esophagus, and they can bypass the swallow so that you are able to get some sort of nutrition. So they said, I think it's time to do that. And I said, oh, okay, I guess that's what we're going to do. Well, had been in so much pain, they had me on a PCA for morphine. And I just kept hitting the button, because I was in pain. And I'm sure many of you can identify with that pain that you get. And I somehow dislodged the nasal tube, the nasogastric tube, and started to cough. They had to call a rapid response team. It was the middle of the night. As I was coughing and starting to lose, my oxygen was starting to go, they had called my husband. They said, you probably need to get back in here. I don't remember this, but he says they were going to bring me to ICU because they needed to intubate me at that point. My O2 levels were dropping. And I said to him, if I don't make it, make sure you tell the boys I love them. And I don't remember doing that because I was so hopped up on meds. But he swears that that's what I had said. So they knock me out, they roll me in, and next thing I know, I wake up and I have a tube. I'm intubated. And I was awake while I had the intubation. They didn't keep me out the whole time because they wanted to see when I could start breathing on my own, in which I was able to. Well, in the end, I also ended up with aspiration pneumonia because of the liquid they were putting through my nose. As I pulled out that NG tube, I aspirated and it went into my lungs, and it gave me aspiration pneumonia. So now I had a whole new host of things that needed to be addressed. X-rays every day, the whole 9 yards. Eventually, they were able to extubate me. It was probably like 3 or 4 days after being intubated, I was extubated. During the time that the last 3 days, like I said, I was awake. So I was aware that the tube was in, and my very close friend, who's also a speech pathologist, she would come in and see me, and I would sign with her or write, questions to find out. And of course, one of the first things I was concerned about when they extubated was my vocal cords, because now all this is coming back. Now, mind you, I am a school-based speech pathologist. And yes, I took dysphagia in, grad school. I did my year rotation, but it's all flooding back. All of those questions are coming back of what do I do and what are the things that are going to happen? And that brings me to the point where they start to need to give me a gastric tube. Now, a gastric tube goes
Before we go to that, Suzanne.
Oh, I'm sorry, what?
Before we go to that, Suzanne,
Yes.
I just want to say how much of a warrior you are. Some people don't like that word, but you have been through some very traumatic experiences. And I just want to let you know that, in the chat, people are relating to what you have said so far. So thank you. I just want you to know that you're doing an excellent job.
Thank you for telling me that. Thank you. I hope that my story resonates with somebody and makes them feel better, it gives them hope. When I was going through that and they gave me my feeding tube, you go and you see an interventional radiologist where they go and they line you up and they give you the tube. And I remember being so afraid of having this tube. How were they going to feed me? How was I going to have it? And here I have this appendage coming out of my stomach, not kind of sure what was going on. I had proceeded to spend the next, I would say it was by that time, it was another 6.5 weeks in the hospital, trying for them to get me to a point that I would be able to be discharged to a rehab center. During that time, they, in addition to the gastric tube, they were able to, thank gosh, start me on IVIG. And for me, and it's different for everybody, the combination of IVIG and rituximab were my savings grace, plus the huge dose of Medrol I was on. They had started me at 100 milligrams of Medrol. I was on that for a very long time, the Medrol. So I just recently, we're in now 2021, it was probably a month ago that I finally weaned off of it. During the time in the hospital, again, I'm not moving, very little, and I'm waiting for these infusions to kick in. And they would hook me up every week, whether it was the Rituxan or the IVIG, and I would have side effects. I would get rigors, which for anyone that doesn't know, rigors are that chills, that shaking that you get, like when you're so cold you can't stop yourself. I would get rigors, I would get hives, I would get all kinds of things. So then we'd have to slow down the infusion. One of the things that that stayed with me the most, and this is what I'd like to really impart to everybody, is for the longest time, I couldn't do anything. And I couldn't move. I couldn't, like I said, I needed help with toileting. I needed everything. But I started to try and identify what could I do today that I couldn't do yesterday, because I was determined that I was going to see some gains. Now with dysphagia, to kind of bring us back to where we were, I remember thinking, okay, well, if I can't walk, okay, if I need to be in a wheelchair, so be it. But I really want to be able to swallow. That was more important to me than walking. And that was because of the fact that drinking and eating are such a social thing. All I could think about is everything in our lives is built around going and eating and drinking, going to parties, going to celebrations, maybe going to a happy hour, taking the kids for ice cream, whatever it was, it unfortunately is always, my weight can tell me, was revolved around food, eating and drinking. And obviously I would ask the doctors every day when they would come in, so you think I'm going to walk again? And they were like, well, we hope so. But the more important question to me was, do you think I'll ever drink or eat again? Will I be able to swallow? And nobody could give me an answer because they weren't familiar with what exactly was going on. And because of the fact that what we have as myositis is so rare, nobody knew for sure what the magic potion was going to be. So for those that aren't sure, again, because I keep using the word and you probably are able to infer it, dysphagia is a medical term for swallowing difficulties. It could be related to different foods. It could be related to different types of liquids, or it could be even just being unable to swallow at all, which is where I ended up. I started with just difficulty with thin, as it went on, I couldn't do thick. I couldn't do, like, it just progressed through it, eventually being unable to do it at all. So there are different types of dysphagia. Mine ended up being losing my swallow altogether. Dysphagia, interestingly enough, can affect so many different populations. The research that I had found indicated that about 13.5% of the general population, mostly seniors, will get dysphagia. So it's not a huge amount, but it's big enough that we will see it and we may know somebody who has it. Most of us will see it in connected with people with neurological disorders. Usually we see it with seniors when they're like stroke patients or Parkinson's patients, where we know that there's some sort of a neurology happening and that causes that system to slow down or to stop. That we do see it in children or who have congenital developmental issues. There could be obstructive, possibly cancers, like esophageal cancer or different conditions like that who might be affected by it. And of course, there are us, the myositis patients, whether we are dermatomyositis, polymyositis, inclusion body myositis, and anyone else out there, it's a possibility for us because let's face it, our swallow is made up of muscles. That is part of the thing that propels that bolus, that food through the system and gets it down to our stomach so that we can gather the nutrients from it that we need and the calories. But dysphagia can also happen to people even who have like GERD. There's such a mild portion of it that when that stuff starts to pop back up, it causes a problem in the swallowing. With dysphagia, there are different symptoms, as you can probably garner from what I've said. There's coughing, there's gagging, there's choking, whether when you're eating or drinking. That was primarily how I had it. There was the bringing of food back up. So you get it down and then you cough and then it kind of comes out. It never really goes through the back of that throat by the pharynx. I was also getting liquids and stuff through my nose. You have a velopharyngeal port, which is up at the top, your soft palate back, that it was insufficient. We call that a VPI. It was insufficient. It was the musculature was no longer closing off my nose. So I would get liquids that would just come through. It didn't matter. On a side note, it also affected my resonance and my speech. So my speech was very hard to understand between being a little bit dysarthric, again, because of the muscles, the jaw and the tongue weren't working correctly. But I also had a resonance issue. Normally you have 3 sounds that come out your nose. I had all my sounds are coming out my nose. So I was very hard to understand, which was another frustrating part of my journey. But that got better, thankfully. So back to our symptoms, you also can have pain. So if you're swallowing and there's pain, that might be an indication that you're experiencing dysphagia. Again, the inability to propel the food all the way down through that pharynx. So you may get it up here, and I'm going to show you a video of what it looks like a good swallow and what a not so good swallow looks like. Sometimes we hear, and I still get this now, is that sensation of food getting stuck at the back of your throat. When you like maybe you're eating rice and you feel like there's just a little kernel of that still stuck and you're like, sorry, but you're trying to clear that through. That's there too. That could be a sign that there is some sort of dysphagia going on. The drooling, that was a huge thing for me when I was in the hospital. I would get this pooling of saliva that I needed to use a yank hour. And if anybody knows what a yank hour is, it's connected to a suction. And I would have to suction out my mouth every couple of minutes because of the saliva that I was building, but the inability to swallow it. So I would drool it out. And that wasn't pleasant to look at either. So I would have a yank hour and I would have to continually suction out all of that saliva and some mucus that I had. You may have hoarseness, and that goes again with the GERD thing, where we're having some irritation that's happening in the esophagus, could be going down towards the vocal cords in the other way. So you could end up with some hoarseness as well. You can have a lot of heartburn and as well unexpected weight loss. And I would assume that a lot of us, I had said I had blown up from a lot of fluid, and that's correct. Then once I got into the hospital, I had stopped eating completely. And I was at the point where I was starting to get treatment. The weight just started falling off. And I think I lost in that 6 weeks that I was in, or 5.5 weeks that I was at Sloan Kettering, I lost probably a good 40, 45 pounds. And then a little bit more I had started to lose, but started to gain a little bit once I got to my rehab facility. Now, there are different types of dysphagia. There is esophageal dysphagia, which is the sensation of being stuck, food being stuck at the back of the throat, and chest after you're starting to swallow. So, you get that feeling where it's kind of stuck right in the sternum or in the back of the throat, like that rice granule. And there's oropharyngeal dysphagia, which these should actually have G's, sorry. Occurs with difficulty initiating swallow. So it may be a gag, a choke, a cough, some difficulty with foods going into the windpipe, up the nose. Now, again, going back to who it affects, as I mentioned before, stroke victims, patients with neurological disorders, whether it be MS, muscular dystrophy, which is kind of where we fall in, Parkinson's disease, certain cancer patients, the elderly, patients with scleroderma, and more. And we know it happens in children, maybe newborns and whatnot. There are 4 stages of swallowing. There's the oral preparatory phase, which is that sucking and chewing of food. So it's putting it in the mouth where we're actually chewing and masticating it, bringing that food, breaking it down so that you can actually get it to swallow. If we had took a cube of steak, we have to chew it down. We have to break the fibers down for our body to accept it. That's the oral stage. We then go to the oral transit stage, and that is the point of moving the food, or that we call that a bolus when we pull our food together, or we group that liquid together. It's moving that food or liquid into the throat. So we're now propelling it to the back with the use of the tongue. The pharyngeal phase is where we start our swallow. Okay, we start squeezing it down the throat, and it's the muscles contract, moving the bolus all the way down the throat in hopes that it's going to eventually go down into the esophagus and into the stomach. The esophageal phase is that opening and closing of the esophagus or the stomach, and it goes down again. So ultimately ending up in your stomach. And you can see down here, I have kind of where the bolus is supposed to be. Okay, so I'm going to show you, there is a normal right here on the left. This is going to be a normal swallow. And then on the right-hand side, we're going to see an abnormal swallow. So I'm going to pause this in between in hopes that we can talk about it a little bit. All right, first they'll show us our normal swallow. Let's hope this works. Okay, so you will see, oops, sorry. Okay, you will see that when they did this, and I'm going to go back and rewind it so that you can see it again. They're taking the food in, and the food is going down here. We're not getting it to go here, which is the larynx. Here is your larynx and your vocal cords, and then this goes down into your respiratory system, which go into your lungs. We don't want the food to go down there because that's where we end up with problems of aspiration pneumonia. So let's watch that again, and you can see this is where we want it to go. There it is, the good bolus, and there it goes down. Beautiful, beautiful swallow. And this is done on a barium swallow, which is one of the tests that you would have done. And you're a speech pathologist, if you ask them nicely, they'll probably show it to you. And it was kind of cool to watch. Now we're going to show you an abnormal swallow, and I want to point out a few things about that. Okay, we're going to stop right there. You see this pooling here? This was not present on the normal swallow. This is called the vallecula, which is a little bit of an opening here. And normally what will happen is your epiglottis will cover, part of the swallow is it will close off your airway so that it pushes and forces the food here. What we're seeing here is the bolus came in. It's pooling in this area. And then you can see some of it went down here, and you can see the trace of it right here going there. That's a poor swallow. That's where we're worried that we're going to get we're going to aspirate liquids or fluids. And water is one thing to aspirate. That's not, so bad because your body will absorb that water. But when we're talking about liquids, foods, anything that's foreign, the body is not prepared to handle that in the respiratory system. Okay, now you can see after that swallow went down, here it went down, and you can see there's sludge. There's some left over here. We could see a little bit of the barium here and here. So this person is not completing their swallow appropriately. Okay, so that I thought was interesting just to see a video of a normal versus an abnormal swallow. Okay, so how do they diagnose it? Obviously, I diagnosed mine beforehand because I just kind of had an idea. But normally what they'll do is there are different ways they can do it. You can have a gastro, they can do an upper endoscopy where they put you out. And, if you've had colonoscopy, sometimes you'll do the upper endoscopy where they'll go in, down through the throat, through the esophagus and look to see what's going on in your stomach. So sometimes they can tell based upon the lining and what's going on there, whether or not you're experiencing any type of dysphagia. There's also the most common one for us would be the esophagram or a barium swallow or a modified barium they'll do. That's usually performed by an SLP and there'll be a radiologist there. What they do with that is they will have different types of foods, whether it could be graham crackers, it could be pudding, there could be a little bit of milk. They'll have different types. There might be soft sandwiches like an egg salad sandwich. So they want different textures and different viscosities or thicknesses of liquids. They put what's called a barium, which is will light up on the X-ray, and they put that in the foods. It's kind of tasteless. You don't really taste it. It's a little odd, the texture of it, but you have to do it. So whatever. So they'll give you a piece of that, and you will not swallow. You start chewing and swallowing when you're in front of the camera, and it watches that whole process, just like you saw on the previous slide of you chewing, masticating it, and seeing how the bolus propels and moves throughout the swallow phase. And from there, they can tell where the breakdown is happening. Are you having trouble in the mouth that you're not able to break down the food? Are you not propelling that food back, through that oral transit phase? Is it not really going through where you're pocketing and you're keeping food in your mouth, which is dangerous as well, because then while you're sleeping or something, the food can slip over. So that's not good either. Is the back, for me, I was having a lot of problems with my pharynx. The pharyngeal wall was not moving to move that food down through the esophagus. So that was a major problem. I also had, as I said, some VPI, where that's why I was getting the stuff through the nose. So they can tell a lot of information from that. Myself, I had to have 3 of them. No, I probably had 4. 4 of them. I had a couple while I was in the hospital, one to diagnose me and confirm the diagnosis of the dysphagia. And then I got them to do 1 or 2 more to try and reverse my gastric tube, but I wasn't making any progress. So off to rehab I went. And with rehab, I worked on PT, OT, and of course, speech. So there I was as a speech pathologist sitting with another speech therapist. And as she mentioned, this has to be devastating because this is in your wheelhouse. And that's exactly how I felt. And I had the best speech therapist ever, where she was just so empathetic for what I was going through and what other patients were going through. There's another type of diagnostic tool. They call it a FEAS, which is a flexible endoscopic evaluation of swallowing. That's also performed by an SLP. It's just a different way for them to go and look. And then there's a video fluoroscopic swallow study as well. And that is also performed by an SLP. And that's, both of those are with advancing something down the throat. But the most common one that you'll find is the modified barium. That's usually kind of where they go. So how do we treat dysphagia? Okay, the good stuff. Usually what they'll start with is speech therapy. And when I was extremely fortunate that when I was in the hospital, unfortunately, I didn't really get a speech therapist there because they're not as equipped. They weren't as equipped to handle what I needed, unfortunately. Thankful for my very good friend, as I mentioned, she gave me exercises. So I would sit and do my exercises every time there was a commercial on TV. And the best way that you're going to cure a swallow is by swallowing. Okay. And that means swallowing just air, swallowing on, just performing that swallow that's the best way that you're going to building up. Just like if you want to build up your arm muscles, you need to do, exercise, lift weights. It's the same theory. You need to keep swallowing. So I would just swallow my saliva if I need it. That's all I would do is just, even if I got dry, I would just continue to swallow. A speech pathologist is going to give you there are different exercises they can use. I'm not going to go into the different exercises because, again, those are very particular based upon where the weakness is falling on your barium swallow. There are some things that could be contraindicated based upon certain conditions. So I would urge you to speak to a doctor and then get you to a speech pathologist who specializes in swallowing to help you with that. I also had done something called a free water protocol, and that was taking tiny, tiny sips of water. And this was after doing exercises for a while, where my speech pathologist thought that I could start to advance, and I was in the rehab center for this. And that was taking tiny, tiny sips, maybe sucking on an ice cube and trying to swallow that water down. And again, just working on that swallow. You might do food or beverage trials where they will give you so many sips or tastes of applesauce or a thick liquid. Often they'll use thickening products like Thicket. And it's kind of bizarre to have a Diet Coke full of Thicket where it's like eating sludge, but it maintains the taste of the original food, but puts it at a thickness that you might be able to tolerate. Not everybody will have to go off foods altogether. Some may be able to have just really thick liquids and be able to handle that if their dysphagia is caught early enough so that they can work on it from that point forward. So those are the main ways. I also had to have an ENT come in because we weren't sure my swallow wasn't moving as quickly as I was happy for it to move. Again, being in the profession that I was, I kind of was very impatient for it. So we had an ENT come into the rehab center, and he scoped me in my room. And they sometimes look at doing an esophageal dilatation where they dilate the esophagus. If the esophagus is too narrow, and that's why the food's not going down, sometimes they'll dilate it, which is to push it open, so to give you more success. So I was evaluated for that as well. That was not anything I needed to do because eventually my swallow was starting to kick in. Again, I mentioned the nasogastric tube, which is the tubing that goes through the nose. That might be an initial way for you to get some nutrition. And then there's also the GI tube, which is what I ended up having. And I had that for about 3.5 months. And there was an opening that was put in my abdomen and a tube coming out of it. And then I gave myself feeds. The feeding happened while I was in the hospital. They did them. And then I eventually had to do my own feeds at home, which really was just a tube that was coming in, and I would have to pour, it was formula. It was like baby formula into it and slowly let it advance into my stomach. And I had to do it every couple of hours. So it was kind of like a baby, but that's what I had to do. So I did it.
Suzanne, is that the same as a peg tube?
Yes.
Okay.
It's very similar. Yes.
Okay, great. Thank you.
Yep. Very similar. So when the tube is removed, it's a great day when it's finally removed. They will not remove it until they see that you're actually swallowing on your own. So you'll be with it for a while until they can confirm that the swallow is happening. It took me probably, like I said, about 3 months or so to have it. I was home for 3 months before it came out. I think it came out in March, and I came home December 15th. So I had an excellent speech pathologist that came to my house every day. Not every day. I think she came 2-3 times a week. And she would work with me as well and really just reinforced a lot of the different exercises that I was doing. There are different strategies that your speech pathologist will tell you to do, whether it might be swallowing with a chin tuck or swallowing with your head to the left or the right, depending upon which muscles were affected. There are different types of things that you can do with your tongue, elevating your tongue up and then trying to swallow. I was lucky. I had, like I said, my friend who came in and gave me a list of things that I could do. So I would practice those until I was able to get more formal speech therapy. But once they kind of knew where it was a better experience. And it took a long time. I mean, obviously the 3-4 months, but what was amazing to me is that it felt like it was never going to happen. It was never going to happen. It was never going to happen. And then all of a sudden it happened. So you have to look at those gains that you make each day. They're small, but together they add up to a really big gain. And that's what you have to do. When I wanted to pass on, one of the things I did when I was in the hospital, I mentioned before, but as I got better and I was able to move my limbs and stuff a little more, and I had my phone because, that was how I communicated with my family and whatnot, because I was 45 miles away from my family. I wasn't seeing them all the time. I would make a list every day of what I did new that day, but what I couldn't do yesterday. So, today maybe I raised my hands for, 10 seconds. Tomorrow, maybe it was 15 seconds, maybe it was take care of myself. I showered, whatever it was. I did my exercises. I was able to hold a swallow for a longer period of time. You have to keep looking at the tiny gains. It's, the little gains add up to big gains. Life after dysphagia, aside from having an extra belly button now, because you still have the scar from it, I still have moments where I feel like my swallow is not normal. I'm back eating and drinking everything, thankfully. My doctor is always in tune with asking me, how is it going? He wants to make sure because it's a sign of whether or not maybe I'm heading towards a flare. I have to realize that some of the strategies I still use now is to take smaller bites, slow myself down. Being from New York, not only do I talk fast, but I eat fast. So I need to slow myself down, smaller bites. Also having a liquid wash, which is, where you take a little bit of a fluid after to help move the food down, is something I still do. Sometimes I still have to use a compensatory strategy, whether it be a chin tuck or moving to the right or left, depending upon how I'm feeling. I think the fear is always going to be there that it could disappear again. And I know there are some patients that it has, and they've had multiple times where they've had to go through the process. And I think it's important for us to just realize that it's there. It may come, but it should be treated. Hopefully it'll be able to be treated.
Hi, Suzanne.
Hi.
Thank you so much. That was just an amazing talk that you just gave.
Oh, thank you.
So many things that I think a lot of us can resonate with, whether it's the dysphagia itself or if it's, being in the ICU and not being able to communicate and treat, show up for yourself because you're incapacitated.
Oh, God. It was, I was very fortunate. My husband was such a great advocate for me. He's an electrician by trade, had no idea what any of this was all about. He knew more about dermatomyositis than probably the average doctor did that we would run into by the time I was let go, because he did so much research because he needed to advocate for me. So it's so important to have somebody there to ask those questions, to make sure that your team is doing what they need to do.
Absolutely, and great for your husband for doing that. It is very important.
Yeah.
You have a ton of questions, so
Oh,
yeah, that's
I hope I can
wonderful.
answer them. I hope I have the answers for you.
I did let everybody know in the chat that you're not going to be able to answer specific case related questions, but if you can't, just say so, and
Okay.
we can provide resources. So
Yes.
the first question from Michael: why does DM cause dysphagia? Could neck harness exercise using on a machine help strengthen the swallow muscles? He's had 2 esophageal dilations that have
Okay.
helped for a few days.
Yeah.
Working.
Yeah. Um, it's the whole it's it's just like us losing our ability to walk or to move or to pick things up. It's the muscles. There are so many muscles that are involved in swallowing, from the jaw to the various neck muscles. It's hard to say why. It's just that there's an overall assault on our system that's causing all of our muscles to give way, to stop working, to atrophy, and those are just included with it. That's the best
Okay,
answer I could probably give you as to the way I understood it.
sure. Are there any medications that are used to treat dysphagia?
Not that I'm aware of. Not that the one that I mean, your steroid, your average prednisone, methylprednisolone, those probably are used more so than anything because they're calming the system down, but nothing specific that I've come across. That they didn't give me anything specific. It was really the combination of treating my dermatomyositis and calming that down and getting me out of that flare, and then that with the therapy, which is what brought my swallow back to me.
Perfect. Thank you. And you did go over some of the procedures in your slide, so we will be sharing that with the video. Ruth, I have unmuted you. Would you like to ask your question?
yes. Thank you very much for telling us your story. I can relate a lot to what you were saying. Dysphagia I did had for in the beginning, like throughout the first year, but now what I have is dysphonia, the paralysis of my vocal cords.
Yes, that's got to be difficult, Ruth. I can't even imagine. Are they treating you, or have you been seeing a speech pathologist for that at all?
Well, I saw my ENT doctor and they were going to start with some injections, but pandemic started, so I was not able to do anything.
Oh, I'm so sorry to hear that. That's got to be very frustrating to not be able to communicate to your fullest.
Yes. I have my daughter. She's always helping me here because she was the one who was with me in the hospital. So
Oh,
she's been my right hand all
That's-
along.
that's great. I'm so glad you have that support with you. That's so important. I hope that I'm not as obviously I know what dysphonia is, but I'm not familiar with the treatments they use for it.
Okay.
But I hope that they find something and give you some relief. I can't even imagine.
Okay. Yes. Thank you very much.
Oh, you're welcome. Please be well.
Thank you.
Thank you so much, Ruth. We appreciate you asking your question, and I too hope they can find something that helps you.
Hello, everyone.
Right,
I am going to read a question from the Q&A. Jennifer asks, were you able to have an instrumental like FEES or an MBS?
I had an MBS, modified barium swallow. I didn't have a FEES. I had an MBS, which is where the speech pathologist and the radiologist work together and give you different food or mediums to swallow that have barium on it. So that I had the MBS, and I had multiple of those.
What is the FES or FEES?
The FEES, is the way I understand it, is they advance like a camera, and I guess they record the swallow as they go, as it happens from internally, as opposed to an external, like X-ray type thing.
Okay, perfect. Thank you.
You're welcome.
The next question comes from Angela. Does having dysphagia increase the risk of having heartburn or GERD?
It definitely could, I would think, because if the food is not moving or the liquid is not moving properly, it may be pooling and staying, whether it's stay in the esophagus or possibly not even getting all the way through the stomach, maybe pooling up by that sphincter. I would think that there is a possibility of increased. I know I was put on Pepcid right away, so that would help. But that's also in conjunction with the steroid and a couple of the other meds that I was on as a prophylaxis. But I would think that there would be an increased risk of GERD with it.
Great information. Okay, we have a question from Mike, and he would like to know, I have had severe dysphagia, and it's not gotten a little better, and now it's gotten a little better, but I find that the area around my vocal cords have become desensitized to food or debris. So even though I think I've swallowed everything, I have to regurgitate several times to make sure it's cleared. Are there any procedures to help know stuff is not cleared?
I would refer you back to your medical team, but you probably should have a swallow study where they can see whether or not when you're swallowing, what traces of food and where those traces are left. They could give you a better idea. That's a huge problem where we start to not feel it anymore. I want to also, and it brings up another point that I wanted to bring, coughing is probably your best friend. People will look at you like, oh, they're coughing, they're choking, they're coughing. But coughing is the best thing, because the coughing is going to expel anything that's stuck there. So if you have to cough, because you're going to hopefully loosen whatever it is and bring it back up into your mouth. And that's important to know. Don't sit there and try not to cough and try to swallow through it, because you're only going to do more danger. Put yourself in a worse situation. So cough away.
Okay, and he has a follow-up question about hypernasal tones coming from his nose, and are there any treatments to help with the vocal issues?
With the hypernasality? Yeah, I had that hypernasality too. And again, it was through speech therapy and working on different exercises that the speech therapist can give you to try and exercise that velopharyngeal port. That's up by your soft palate, and your soft palate is not closing the way it needs to. So therefore, all that air is moving through your nose, and that's giving you that nasality. So unfortunately, I can't speak to your individual circumstance, but it is something that can be worked on through speech therapy, because I had the exact same thing, and it came back. I wasn't sure that it would. I sounded like a completely different person, but it came back. So and I think the combination of exercises for the dysphagia and the hypernasality, it just worked together.
That's really good to hear. And that actually takes us right into the next question. Suzanne, how did your speech improve?
I am back to 100% where I was, back to normal tone. My New York accent is back. It was slow going. When I was in the hospital, I had lost all of that ability to articulate precisely. And that was partly due to the musculature plus the resonance issue. It made it difficult when I needed the call button and I had to call somebody because they had no idea what I was saying. It took a while, but eventually it came back. It probably took as long as the swallow did. So from the time that my articulation went and had difficulty with it, it was probably a good 3.5, 4 months. But it did come back. Speech therapy works.
Well,
imagine that.
Right.
Imagine that. I was like, wow, this really works what I do.
Validated your life for you.
Yeah,
huh?
seriously.
And I would love to share with you what Dawn just posted in the chat. She's thanking you. She's dealing with this right now, and she feels encouraged to work harder on her exercises and not so afraid of her future. So
do it. It will work. I don't care if you're sitting in front of the TV and every time a commercial, God knows don't VCR it, but every time there's a commercial on regular standard TV, do some of your exercises. It's boring and it feels useless, and it's work, it's hard work, and it's exhausting, but it works. Just keep with it, please.
That's so great, Melissa, or excuse me, Suzanne. I was reading the next question. Melissa asks, tells first, she had a barium swallow and an esophageal manometry. Although she was not diagnosed with dysphagia, she's still experiencing the symptoms of dysphagia and is wondering if you can suggest what they can do to keep trying to figure this out before it gets any worse.
Oh, I would say if you're continuing to have it, keep having modified bariums, or ask them to do a FEAS. See if they can do another type of swallow evaluation and not stick with the modified barium. You know, maybe the FEAS. I don't know much about the FEAS because I haven't experienced it as much, or I haven't experienced it at all. But from what I've heard, it might just give a different perspective to it. So I would definitely suggest asking whether it be your ENT or your rheumatologist or whoever it is that you're working with that's on your myositis team, to pursue an evaluation from another perspective, but definitely to continue with it, because if you have the symptoms, something's not right.
Wonderful advice. Thank you. And good luck, Melissa. We're here for you.
I was getting ready to unmute and my dog started barking. I'm so sorry. Okay, so Loretta would like to know, is it okay to use a straw when you drink from a cup or glass?
Interesting. It depends again. And I'm sorry, I keep giving the same answer, but it really depends. Oftentimes, a straw would make it easier because you're controlling the flow of the liquid into your mouth, as opposed to taking a drink through the glass, on the rim of a glass. When you drink on the rim of a glass, the liquid just flows through. When you've got it through a straw, you're able to kind of control that a little bit better. So straws usually are a little bit more helpful. The other thing, which I found really, and I was so excited, was that carbonated beverages were better than non-carbonated beverages. And I guess it's the bubbles that are in the carbonation that holds the liquid together a little bit more. That made it a little bit better. But again, I caution you, just make sure that you're at the point that you're able to start taking it. But that is definitely something to ask your speech pathologist if you're ready for maybe like a carbonated ginger ale or something like that, that you could take in small little sips.
That's a really interesting point, Suzanne. I do not have a diagnosis of dysphagia, but I have trouble swallowing sometimes. And I feel like I get coated sometimes, like things just, even though I can swallow, I have like a coating. It doesn't all go all the way down. It kind of gets
It's like the
stuck.
sludge. Yeah,
like a mudslide.
Yeah.
And so sometimes I want to drink carbonation because I feel like it breaks it up as it goes.
Yeah.
So that's really interesting that you just mentioned carbonation.
Yeah, it's amazing that it did. And I used to be a former Diet Coke addict. So like I was like crazy for Diet Coke. So that was like golden news for me.
Me too. And now I can't drink it anymore.
Yeah, me neither.
So Donna would like to know, when seeking a speech therapist, are there any tips to find someone who can help with dysphagia from myositis?
Yeah, you want to work, first of all, you want to work with somebody who is a swallow specialist. Like every field, like doctors, there are specialists in each field. And you want to look for a speech therapist who has extensive background working with dysphagia or dysphagia. Make sure that they have a lot in their toolbox, if you will, of different types of people they've worked with. Now, myositis, obviously, we're a rare bunch. We are the zebra in the group. And, the speech therapist that I worked with two different ones. And the first one, she thinks one person before that. She couldn't recall. And the second one that I worked with, which was great, didn't have anybody with myositis, but she was familiar with the swallow process. And that's what you really want, is somebody who's familiar with the process of swallowing. I don't think it's so much the fact of the dermatomyositis or the polymyositis or the myositis in general, because they can learn about the myositis It's them having a good understanding of the swallowing mechanism and the musculature that's around it. And they can work with that, together, but definitely finding a specialist who works. You can go to ASHA, the American Speech and Hearing Association, and they have, I think you can do a search for your area and find speech pathologists based upon different specialties. And I'm pretty sure they have one that has to do with dysphagia. I think you can search by that, and you could find somebody that way also.
Excellent information. Thank you so much, Suzanne. And I believe I can get some resources from you that we can add some additional to our
Yes.
website as well.
Yes, definitely.
Great, thank you. So I would like to, Roxana has her hand up. Would you like to ask your question? What?
Yes, thank you. Forgot
You're
to.
welcome.
Hi, Roxana.
Hi. I have two prongs here, and I'll let you know, and then I'll hang up and listen. Sometimes when I'm eating, the roof of my mouth becomes extremely painful, and I have to stop eating until that goes away. And then also, every now and then I'll be drinking something, and all of a sudden I have to start coughing, and I'm coughing up foam and almost can't breathe.
Oh,
Is
gosh.
it part of the dysphagia?
Yeah, yes, I would think so, that they're both part of the dysphagia. Because again, if we go back to the different stages, dysphagia can happen in any of the stages, whether it starts with your mouth, it goes back, the transit, or back into the throat, down to the swallow. So I would definitely consider them to be all part of the overall condition of dysphagia. And I would definitely bring it to the attention of your doctor and see if you can get some sort of a recommendation to have it looked at by either an ENT or a speech pathologist, to have them see where they think the issue is and what they can do to help you. I would say it's definitely part of it.
I had the MS,
An MBS?
the MBS. I had that several years ago, and I did have trouble swallowing then, and took some training for it, and I still do some of those exercises, but it's definitely getting worse.
Yeah, you definitely bring that back up to the attention, because you know what, even though you're doing the exercises now, getting an update on the therapy could possibly, there are always different therapeutic modes that are coming into play that they're doing research on. And there might be some new tricks that they can teach you to kind of help you strengthen that, so that maybe we can preserve the swallow as long as possible.
One trick I do is when I'm eating, of course, you said the smaller bites, and then I use hot water to chase the food down.
Oh, good. Small sips, I hope.
Oh, yes, small sips, but that hot water seems to help relax the throat and get the food down. So
that's so interesting. I'm glad you shared that.
I will say thank you to you and Jerry for everyone.
Oh, thank you so much for coming on.
Thank you so much, Roxana. We're here for you.
Thank you.
You're welcome. Emily.
Okay, so we have one last, wish I could speak. One last set of questions in the Q&A, and it's from Mary. And she wants to know, I think that's GERD, right, Mary? If GERD can cause dysphagia.
Yes.
It says HER, GERD. Okay, good. I thought I knew you well enough to interpret that. And then and then also that you've had 2 swallow studies, and that they didn't have gluten-free crackers. So I guess that was difficult to do those swallow studies. So Suzanne, I'm going to throw it to you.
Yeah, you know what? That's a great point, Mary. Sometimes they'll ask you to bring your own food. And I would suggest, if you're on any specific type of a diet, before you go and have your MBS or your tests, that you ask them what textures they're looking for. And if you're on a specific diet, like gluten-free or plant-based or keto, whatever it might be that you're on, to see if you can, if possible, can you bring your own foods, and then they can just use the barium with your foods. That's not a problem, because usually it's a paste or something to mix in. So they should be able to do that for you and accommodate you so that you can get a really good result on your test to make sure that it's an accurate result. Great idea.
And
And
Mary,
then on the GERD,
oh,
sorry.
I just want to say, Mary, I have unmuted you. So if you, or excuse me, I have allowed you to talk. So if you want to unmute yourself for follow-up, you're certainly.
When I went for the test the first time, I didn't realize what a swallow test was. I didn't know I was going to be eating food.
Yeah.
I was just swallowing. And then the second time, I don't think I knew I was going to have the test, and they just decided to do it while I was there.
Oh.
So both times it was just misunderstanding.
Yeah, kind of surprising for you. As far as the GERD is concerned, I would think, yeah, GERD it's actually part of being dysphagia, having dysphagia, because of the fact that something's going wrong in that swallow process. So if you're experiencing a lot of GERD, that gastroesophageal reflux that's coming up, definitely mention it to your doctor and your concerns if you have any other symptomatology that might be connected to.
I don't do the nasal stuff, but I just get very hoarse.
Yeah. Well, it could be also, do you drink a lot of water and stuff?
Yes, I do.
Good,
Yeah.
Good. Because you want to keep that whole area kind of moist, in your mouth and down, because it could, if you're coughing a lot, your vocal cords could be drying out, and that process could be drying out. But if your resonance or if your speech is changing, then you definitely want to probably look at an ENT and have them look to see what's going on. They can always do a scope where they go through the nose down to look at your vocal folds, and they can see if anything's going on there that could be causing the hoarseness. Are you hoarse on a regular basis, or it just comes and goes?
Just when my coughing gets bad, then I get really hoarse.
Okay, that could be that you're fatiguing the muscles of your vocal folds, because when you're coughing, you're bringing up air through the respiratory system, which is going through those vocal cords. And those cords, you can't see, but they come together and they slap together, and that's how they make noise, because the sound comes up through them. So when you're coughing, you're really kind of clapping them together as you're coughing, and you're probably fatiguing them.
She taught me to do a silent cough. To me,
yeah.
I call it a dog cough. Everybody knows what a dog sounds like when they cough, and that's really made a big difference for me.
That's great. That's awesome. I'm so glad that you found something that can help you.
Yes.
Awesome. Thank you.
Thanks, Mary.
Yep.
And we're here for you always. Malady has a question. What is the difference between an SP pathologist and a SP therapist? Is the pathologist an MD? And I think I know the answer to this question, but I would love for you to answer it.
Okay. We kind of use the terms interchangeably in many situations. We're all speech-language pathologists. We are licensed by our states, and we have a certification. Most of us carry the certification through the American Speech and Hearing Association, and we're trained as speech pathologists. You will hear us refer to ourselves as speech therapists because it's just shorter. And people kind of get a better understanding of that when you talk about a physical therapist, an occupational therapist. It's just easier. We are not MDs, but we do have graduate study. We've all gone through grad school. 25, 30 years ago, they didn't have to go through grad school. They had to have their bachelor's rather. That has since changed. There is talk about having us go through our doctorates. But at this point, the majority of us just have our masters. You will have a handful that have gone for their doctorate, but most of them are masters.
Excellent. Thank you so much for that clarification. And don't say just the masters. That's a huge
I know that's a terrible word, and I should know that.
I do it too. Well, I'm just a blah blah blah, or just a.
I'm not an MD. I'm just
Okay. Well, it looks like you've done such a great job, Suzanne, not only educating us but sharing your journey and your experiences. And there are so many things that have come from this that I know that we're all going to be talking about in the groups for a while. And I look forward to that discussion. So
Yes, I'm glad. I hope it was helpful for everybody. And I'm in the groups in and out. So please feel free to reach out to me. If you have a question, you can DM me on Facebook. I'm there. Or reach me at Suzanne at understandingmyositis.org. And I'd be more than happy to help or help point you in any place that I can to try and help you with your question.
and that sometimes is the biggest help. So thank you for that.
Thank you for having me. I'm so glad that I was able to kind of come on and do this.
Yeah, it's been my honor. I've really learned a lot, and from the comments, so have a lot of other people.
Good, I'm glad.
So thank you so much for your time and again, your experiences. And if you want to reach out to Suzanne, again, she's in the groups. Her email is Suzanne@understandingmyositis. And just a reminder that it is Awareness Month, Myositis Awareness Month. So please check out other upcoming video sessions like this, video support sessions, which are not recorded. And we have other events and activities. And if you are able to donate, we do appreciate it. Understandingmyositis.org/donate, or you can text the word myositis to 44321. We appreciate any amount, $5, $25,000, whatever the amount. It goes directly back to myositis patients in some form, because we are an all-volunteer organization and we don't have high overhead, so we're able to help additional patients. And we thank you for volunteers like Suzanne and many others like Emily and myself. So thank you. Have a wonderful evening. Thanks for joining us tonight, and I hope to see all of you soon. Thanks again, Suzanne. I wish you a very,
Thank you,
very good
everybody.
good night all.
Thank you, Suzanne. Good
Good
night.
night.